You ever feel like you're just constantly putting out fires as a parent, one thing after another? Well, today we're going to look at a totally different way to think about raising our kids, and it comes from the world of public health, of all places. It's all about getting ahead of the problems before they even start, and really building a solid foundation for our kids to thrive. So let's dive in.
This is the big one, isn't it? This is the question that I think keeps so many of us parents up at night. How do we get off that hamster wheel of just reacting to every little thing and instead start proactively building real, lasting resilience in our kids? It can feel like this monumental task, right? But what if there was a simpler, more strategic way to think about it all?
Well, this is where retired clinical psychologist Lane Lassiter comes in with a really game-changing idea. He suggests we can borrow a playbook from a field that is all about preventing problems on a massive scale, public health. And the core idea is simple, really. It's about creating a system of, well, continuous, gentle course corrections. So what is this public health playbook? It basically helps us shift our focus. Instead of zooming in on every single isolated behavior, the homework, the messy room, we zoom out. We start looking at the bigger picture, our child's entire ecosystem, their health, their environment, and what that all means for their future. And here's the best part. It really boils down to just 4 simple, powerful guideposts. And to make them super easy to remember, we're going to use an analogy. I want you to picture yourself as a gardener, okay? And your child's well-being, that's the garden you're tending to. All right, so let's dig into these 4 pillars. Think of them as a complete system for proactive parenting right from the ground up. First up, we have health promotion. In our garden, this is all about preparing rich, fertile soil. It's the foundational work, right? Creating a home that feels safe and nurturing, providing good food, plenty of sun and water, and just giving them the space they need to grow, even if that means they make a few mistakes along the way. That's the good soil. Next up is what we call primary prevention. So if health promotion is the soil, this is where we build a strong fence around the garden. It's all about looking ahead, thinking about potential challenges or pests, and putting some safeguards in place before problems can even take root. Then we've got secondary prevention. Let's call this proactive weeding. A good gardener walks through their garden every day, right? This is about staying vigilant, spotting those little weeds, the small issues as soon as they pop up, and gently pulling them out before they spread and become totally overwhelming. And finally, there's tertiary prevention. This is about knowing when it's time to call in an expert. Look, sometimes despite all our best efforts with the soil and the fence and the weeding, a plant gets a disease that's just too big for us to handle alone. Seeking professional help isn't a failure, not at all. It's a vital and frankly courageous part of our parenting toolkit. Okay, so that's the framework. That's our gardener's guide. But why is this preventative mindset so incredibly important? Well, research from the U.S. Department of Health and Human Services lays out some pretty sobering facts that show just how high the stakes really are when it comes to our kids' mental health. Just take a moment and let this number sink in. 50%. Half of all diagnosable lifetime cases of mental illness begin by age 14. 14. This isn't about some distant future problem. The window for prevention is right now, during childhood and the teen years. And the data keeps coming. By age 24, that number jumps to a staggering 3/4, 75%. And as you can see, the research is crystal clear. A child's mental health isn't something that happens in a vacuum. It's deeply connected to this whole web of interactions: family, school, their community. But here's the good news. Early intervention is incredibly effective at preventing more serious issues down the line. So, how do we actually apply this? What does it look like day to day? Well, it really comes down to understanding 2 competing forces in our children's lives. We're talking about risk factors and protective factors. Think of your job as a parent as a constant balancing act between these 2. So, on one side of the scale, you've got risk factors. These are things like stress, instability, maybe some negative influences. And they can really pile up and weigh a child down. But on the other side of the scale, you have protective factors. These are the buffers. Things like strong family bonds, a supportive community, having a sense of purpose. And these don't just cancel out the risks, they are the very things that build resilience. Okay, so let's bring all of this home. Let's turn these big ideas into a practical, everyday toolkit that you can actually use. Here's your actionable plan. So here it is, your core toolkit. Number 1, promote health. That's tending the soil. Number 2, prevent problems. That's building the fence. Number 3, intervene early, which is pulling the weeds. And number 4, treat when needed, which means calling in the experts. See, this isn't about being a perfect parent. Nobody is. It's about being a proactive and strategic one. So, I'll leave you with this question to chew on. This isn't just theory, right? It's a call to action. Take a good look at your child's world, their friendships, their hobbies, their life at home. What is one small, totally achievable thing you can do this week to add just a little more weight to that protective factors side of the scale? Because honestly, that's where the real magic happens.